Good morning, everybody. Welcome to our media panel discussion on climate health for Africa. My name is Joshua Weinberg. I'm Vice President of Strategic Communications and Marketing here at AGU. And we are so pleased that you've chosen to join us for this really important, very thought-provoking conversation. So thank you again. I'm going to explain a couple of rules of the road, if you will, how we're going to establish the dialogue here with translations. So this conversation has English and French simultaneous translation. So what you want to do is click on the interpretation globe in the menu at the bottom of your screen and choose the language that you would like to hear. I'm going to be moderating this panel discussion, and so I would like to introduce our esteemed panel now. First, Dr. Wassila Thiaw. He is the research meteorologist and head of the international desk at NOAA's Climate Protection Center in College Park, Maryland, here in the Washington, D.C. area. Dr. Nafisa Tao Touré. She is professor and head of pulmonology at UCAT in Dakar, Senegal. Dr. Susan Ramisha. She is the Senior Research Officer for the Malaria Atlas Project Telethon Kids Institute in Perth, Australia. And finally, Dr. Mercedes Pascual, the Lewis Block Professor of Ecology and Evolution at the University of Chicago, one of my favorite cities, but I need to get to Dakar and Perth, and then they'll be my favorite cities too. Doctors Touré, Thiaw, and Ramisha are conveners of this conference and have worked for several years to make this a reality. Dr. Pascual has been an integral member of the program committee, so I want to thank them again for all the hard work that they put into making this happen. I'm going to ask the panel some introductory questions to give an overview of the conference, and then we're going to take questions from all of you, from the reporters in the audience. If you would like to ask a question, please use the Q&A feature in the menu. Tell us if you would like to ask your question live, or if you prefer, we read the question to the panel on your behalf. We can do that. Just let us know. If you want to ask a question verbally, we'll call on you and open your mic so you can speak. And when you do ask that question, please include your affiliation when you do that so you can introduce yourself to the panel. You can also enter a question in the Q&A box at any time, and we'll take questions in the order that they'll be received. We're going to end in 45 minutes at 7:45 a.m. Eastern. Very important, lastly, and then we'll get to our great discussion here, is if you have any technical difficulties or questions for us on the staff, you can reach out to us directly in the chat, obviously, but also by email at news@agu.org. So I'm going to start this off with Dr. Thiaw and ask you what motivated this meeting and what outcomes are you looking for?
Thank you very much. We all know that temperature has been trending upward, and this has resulted in more intense and more frequent extreme events such as floods, drought, and heat waves. And we're already feeling those consequences. However, there is little awareness that extreme weather events have negative impacts on human health. Diseases are not widely reported, and people actually just don't understand the risk of exposure. So because of that, and now that we know that we have developed these climate models and we have made improvement in climate forecast, so we'll take advantage of those advances in climate forecasting to enable decision support services in health. So the overarching goal is really taking advantage of technology to advance early warning and reduce risk. And the objectives for this conference is to review the state of the knowledge of climate and health linkages and to stimulate discussion between all the participants, including the scientists, both climate and health, but also program managers, policymakers, to raise awareness of the benefit of using climate forecast to enable decision-making in health. So, and hopefully it will lead to forging a collaborative work between all the stakeholders to make climate-based health early warning system a reality. So that's what we're trying to achieve here. It's a multidisciplinary conference, very unusual for an AGU Chapman conference. The program committee is quite diverse in terms of background and expertise, and that's what it will take to advance early warning systems. So I'm just excited and delighted that we're having this conference, and hopefully it will set the stone for advancing early warning system once and for all. Thank you very much.
Thank you, Dr. Chow. It's a great way to frame the conversation and open up our dialogue. This conference is really an outcome of all the partnerships around the world to make it happen. AGU is a place that's really powered by partnerships, I think. So in that spirit, Dr. Pasquale, when we focus on climate early warning signs, and we have all these great minds here, how do you speak to those? What are those early warning signs? And if you can give some examples of those in Africa, that would be great.
Yes, so for infectious diseases, of course, we know that seasonal epidemics can vary greatly in size from year to year. Also, for non-communicative diseases, we can also have variation across seasons. And so the variability of climate is a major driver behind these patterns. The idea in early warning systems is to take advantage of this variability to anticipate events, and to do so to inform preparedness, prevention in a timely fashion. So some examples would be for the use of changes in sea surface temperature in for example, the South Atlantic, the tropical South Atlantic, changes in rainfall for anticipating malaria in Botswana. Or, for example, using the El Niño Southern Oscillation to try to predict malaria in Ethiopia. Those are some examples. And I would say, yes, so those are good examples. And of course, we can try to take advantage of climate forecasts themselves to have longer lead times.
Yeah, I guess picking up on the examples that Dr. Pasquale mapped out, Dr. Toure, why is climate change a public health issue? Maybe that's an easy one, but maybe the not so easy one is if you can talk a little bit about exactly how it impacts climate health. And I know this is a broad question, but maybe some examples if you can offer, that would be most appreciated.
Yes, it is exactly a public health problem, because there is an impact on human health, but also on animal health. We know that climate change will affect, for example, especially some extreme climate change, some extreme change in temperature will have a consequence on the health of the population. Thinking about an example in 2003, for example, there was a heat wave in France that caused a lot of deaths in France, because people were not prepared to sustain that kind of temperature. Another example is that some infectious diseases impacted by some vectors like mosquitoes and other animals, or in Senegal, for example, we have an increase of cases of infectious diseases. The other thing is an impact in the food chain. We know that there's, for example, fires, wildfires, things like that have a risk to then cause impact the food chain and then create a drought, for example, or a famine. So those are examples that are linked to climate change, and that also cause population migrations. Of course, there are other complications on mental health. And so just as a summary, that is a short summary of all the impacts that can be caused. And of course, this calls us to prevention and to avoid those changes.
Yes. I have to mention, it's kind of a elephant in the room, I guess the saying goes, about wildfires that you talked about. So here, obviously on the East Coast of the United States, a lot of news was made by the Canadian wildfires and the wildfires that were then impacting climate health here. I thought it was an interesting moment for a corridor of the United States that controls so much power and policy to sort of get that wake-up call for maybe the first time in many people's eyes to sort of understand what that means. So from Africa and from the policy and the sort of academic and research world, how was that covered in by African press? Was that something that was making news? I was just kind of curious, as far as there's obviously big news here and the air quality and the effect that the wildfires were having from, you know, Boston all the way down to Washington. It was that moment where people sort of felt like, oh, now maybe now we get it. I was just curious how that translated or was covered.
Yes, exactly. These are things that we've had too, and that caused a lot of difficulties, and a lot of people who were impacted had tremendous difficulties to adapt to it. Those are things that also happen in Africa. Of course, we have, for example, in Senegal, that is a sub-Saharan country. It happens, for example, that we have sandstorms coming from the Sahara Desert, and that is an example of these climate change phenomenons that are being caused, but also are causing other respiratory diseases, for example.
Merci. So, Dr. Rumisha, we're talking a little bit about the causes and some of the initial areas to look at for this whole area of issues. But who's coming to this conference, and what fields of research are represented? And I guess as a follow-up, why bring everybody together? What's the hope in terms of getting all of these people from different fields together to discuss this?
Oh, thank you very much. Actually, it's a very good question, and I'm excited to respond to this question because it took us almost 10 years if we started conversation with Wassila to make this meeting a success. So that's a long journey, and you can see from the map there, if managing to capture that variability of representation from different countries in Africa, in Asia. You can see it from Australia, but also the American side, Canada. I think that's a beautiful representation, and we have over 15 countries in Africa, and you can see spread out, and that is a beautiful representation. So who are coming actually? Wassila already mentioned a bit about that. We have researchers and academicians from climate and health sectors, which these are the two groups that we try to put them together in the same room to talk, to have a dialogue. But we also have policymakers, and that includes like program managers, people who are making decisions. Those are sitting in the tables to make decisions, like if there's something need to be done in a country, there is a practice need to be changed, there is like message that has to go out. These are people that they are also going to be in the room, and we are hoping that bring them together with the scientists and academicians who they are doing the research work. It's going to be a beautiful moment, bring them and speak on the same and listening to each other. But we have now another layer of participants, which these are funders. So because we have representation of people who are actually making decisions about money, Because sometimes researchers will fight and we have our ideas, but sometimes we don't have a direct communication with the funder. And I think once we have these people in the room, it's an opportunity to talk to them. And even for them to listen to us, they may be able to understand how we struggle and what we need to see happening in the community, particularly for these early warning systems. But so we have also here from US high-level officials, representation from embassies, and we think these are the people actually they kind of sit in different bodies, and we have international representation like USAID, WMO, and what we think that bringing them together in the same room is really, really critical. And you ask about why bring them together, or why bring them, for example, here. I would like to speak about why America, because we could do this conference somewhere in Senegal, somewhere in Tanzania, anyway. But Wassila and Pasco has been talking about the advancement that America is farther ahead into these technologies, and we have NOAA, we have NASA, and I'm working with Malaria Atlas project where we use a lot of data from NASA. Climate variables. There's so much technology, and we would have loved to have a massive representation from those people who they are. We call them the gurus. Then these people who actually we are working in the African context, we can have this discussion, these dialogues. So the core part of this meeting, actually bring them together, is to have the dialogues, and we are believing that at the end of this meeting, each of these groups will come out with something that will push the agenda of early warning system forward. And we are expecting to see much more in the future. Thank you.
Thank you. Yeah, that's a great summary, big overview. And obviously it's so hard to get people at the table, both metaphorically and real at the table. So congratulations and hats off to you. But what's even more difficult is after you get them to the table, figuring out what that actual policy is going to look like. So that's a great setup to go back to you, Dr. Chow, to talk about what is an effective policy for climate adaptation and health look like. And I know that's a big that's a big question, but we've mapped out some of the problems and also who's here to talk about this. So what does that policy look like?
Yes, when we talk about early warning system, any kind of early warning system, it's multidisciplinary. It has to be inclusive to be successful. So when we talk about climate-based health early warning system, or even climate-based food security or agricultural warning system, I think that meteorology, weather, climate is at the basis of that. Without it, we cannot talk about climate-based early warning systems. So that means that we have to work together, because meteorologists can only provide data, climate information, but then you need to take it to the next level. So that it will require interagency collaboration. It will require that policies put in place to enable the interagency collaboration. So this model that I'm showing there summarizes the policy that need to be put in place to advance early warning system, where you have the metadata, using them to make forecasts, but then you have to have get livelihood data to understand vulnerability of climate variability, how people feel about extreme events. Then you need to bring that knowledge integrated with the climate forecast to co-produce the impact-based forecast. That is, what are going to be the outcome for food security, or in this particular case, what are going to be the outcome for health. But then you need to message, that early warning, and then disseminate it to the public. So for intervention. So you see that it really requires a lot of stuff, and no institution can make that happen. So that is why it is so important that we can bring together the climate scientists who are doing the research, but also the climate forecasters. These are different. The climate forecaster understands the science, but is not doing fundamental science, but need to use that science in order to transition the research into operation, into forecast. But then we need to also understand vulnerability. So the social component is critical. So how do we integrate that using technology to integrate those two to really map out risk that we can share with the public? So it requires a lot of institutional commitment. And I think that the model that I'm going to be using here is the USAID Climate Early Warning System Network, which is really based on an interagency agreement between USAID and several US government agencies, but also working collaboratively with the international community to prevent risk of famine. In fact, FuseNet, Famine Early Warning System Network, has been so successful that over the past 10 years or so, there hasn't been any famine anywhere in the world. And that is thanks to really using actionable weather and climate forecast, working with the international community, providing funding resources so that we can mitigate impact of extreme events. So advancing the climate-based health early warning system, we are modeling it with successes from the Climate Early Warning System Network. It's a challenge. We've been talking about it for the last 15 years. I'm just so grateful to see that it is now happening. And actually, it turns out that we are actually even testing pilot projects as we speak in some countries in the world. So I think that hopefully, if we can sustain this working collaboratively, we can make leaps forward. Thank you.
Thank you. No, that's and how inspiring that there is an example to point to, that there might be hope out there for that kind of collaboration. So I'm so glad you brought that up. And I guess in that spirit, Dr. Pasquale, trying to get all these in the graphic, all those interlocking areas, but then when you think of countries, interlocking those countries within the continent of Africa, getting that sort of interdisciplinary Pan-African network working. How do you do that? And is it something that is from the bottom up, where it's led more by the research and academic community that's helping lead their governments? Or is it sort of a push and pull? And if maybe you can speak to that a little bit. It's a difficult road, difficult journey.
Yeah, it is. Yes, well, the clearly, as the example you gave of the fires in Canada illustrates, right, the impacts of climate are not going to have boundaries, and intervention efforts to improve health conditions, in particular for communicable diseases across a border, can be undermined by what happens next door. Mm-hmm. So clearly these have to be regional efforts, perhaps not continental, but certainly regional in terms of impacts. The other thing is that you mentioned whether it's top-down, bottom-up, you need both elements. You need, of course, the knowledge at the base, the collaborations. This is a very multidisciplinary effort, but you need conditions that enable it, with funding, but also with the interest of policymakers to use the science, to promote the science, and also to communicate it to populations. I mean, you have to put in place something that is fairly complex. You need many players, and recreating the wheel in every country is not what we need to do. Also, at the base of this, we need substantial data. There is a lot of collection of data in surveillance. You talked about vulnerability. I think the climate science, the cyber field, is already very far ahead in terms of data collection and production. I don't think the health sector is there, not in an organized fashion and in a continental fashion. And that is a very big limitation for producing models.
Thank you. And Dr. Toure, if you could maybe follow up on that as far as bridging governance, research, kind of connecting the dots, if you will. What's your perspective on that? And, we've talked about, obviously, funders, about modeling and data. Maybe if you can offer your perspective on bridging those two together, the research and the governance and policy.
Yes, like the other one said before me, it is very important to work together. That would actually help us to create policies that would actually produce some results, and that is extremely important. It is extremely important that there's this link and this collaboration between the scientists and the policymakers, especially because if everyone is only working on in their corner, if everyone stays in their corner, there will not be any significant results or any significant solutions. And like Mercedes said just a little bit, if there's no effort from countries, from a whole region, we will not have any impactful result. So there could be different results, but to really be able to get to something that we can present, that can really change on the social context, the economic context. So it is also extremely important that the researchers take into consideration the populations, and to really center the research on the population needs, and also really to solve different problems, different challenges that are created. So all of this will help by having this dialogue, this interdisciplinary collaboration between the scientists and also the different regions. I'm taking the example of Africa here, but really there are different countries with different populations, but all of them are equally exposed. So we're in this all together, and even um, uh, underdeveloped countries, the the developed countries should also work with underdeveloped countries to really get to results and also prevention.
Merci. So Dr. Touré was talking about kind of maybe having that first, it's difficult to take that first step. So a kind of a question for you, Dr. Ramisha, is, are there examples in the policy or academic research arena of institutions, people, governments that successfully have taken that difficult first step? Nobody wants to dip their toes in first. They want to look and make sure everybody else is joining them, but you sort of need that first person or that first body, as Dr. Touré was articulating. What are your perspectives on that, and how do we encourage that sort of bravery to kind of get out there and take that first step?
Thank you.
Thank you.
I will respond to that, and maybe someone can add on examples. But from my experience, if you take, for example, the two sectors, take health and climate, and they are both great. We are doing a great job, and also in the terms of developing policies. Like sometimes to be able to take that move, sometimes it's about also, you need certainty sometimes. Some people, they need to be sure that if I'm gonna do this, because putting policies in practice into the countries is not cheap. It's a very expensive process. So we have loved to see something that once we put it, it's gonna work. And you can have a lot of resistance, because sometimes people, they don't have enough evidence to be able to do that. And that one, sometimes I was not following exactly the French part because it was of the language difference, but I was getting a bit of what she was talking about. Sometimes when you have an evidence or a testimony from another country that this has worked here, and that will make that step possible, because they have seen that happening, and then you learn from that experience and that lesson to be able to say that, okay, let's also apply this in this region. Talking about Africa, we have a lot of diversity. The continent itself is so different, but we have also similarities, and sometimes that's where we learned about how to apply this to make these first steps. But another challenge is about money. money is always in the pressure, because sometimes as people, they will think like, this is too expensive. We can't do this because we cannot afford. Because sometimes it's putting a policy and be able to maintain that over time. We don't want to put something that we cannot manage it over time, because otherwise you won't see the impact. You can see the time. It takes time before you see something. And this financial crisis is always at the back of our minds when you sit at the decision-making policy desk, that can we afford that? And that, I think, is where we need funders. We need someone to be there to help us to listen to these challenges and these difficulties, and be able to ask someone that can also contribute, because we have now money from government, from international organizations, from different bodies, which it has never been enough. But that commitment that we've been talking about is also going to help that, so that at least we are feel a little bit relaxed about we can do that, and we're able to sustain that over time.
Thank you. Yeah, no, money money is always at the center, unfortunately, but it's a reality. So that's a very good point. Dr. Chow, just going back to you as far as the work that we'll see unfold here in the next couple of days, how do you plan to hold on to it, to harness it? There's going to hopefully be some great discussions, some hopefully great outcomes. How do you propel that into actual plans and actual action? There's so many things that we can look forward to in the rest of 2023, General Assembly, COP28, other convenings. How do we take the spirit of hopefully what comes out of here to really make change and get more people on board?
Yeah, actually, to piggyback on the last discussion, money is important, but also at the same time, dealing with impacts of extreme events can be even more costly than prevention. So I think that it's just a matter of prioritizing early warning system, and of course, the prioritization need to be done at national level. But from my experience, I think that what really works is a bottom-up approach, because there is a lot of, there used to be, I should say, a lot of skepticism about integrating climate forecast into decision-making. And it took us a long way to really convince decision-makers that it is important, even with some limitations. And now that we really have reduced the error in the forecast, it's even more timely to really try to use these forecasts to enable decision making in any socioeconomic sector. So we have clear examples now that absolutely using climate information, climate forecast can help reduce risk. So it's just a matter of now making sure that we can build confidence and convince policymakers, decision makers that this is really the way to go. So we're going to achieve that through pilot projects, hopefully. But again, the bottom-up approach is extremely important, because you need to show, government need to be exposed to these ideas, and we need to show that they can be successful with just little money. And then from there, when they buy into it, they will provide the resources that are needed to enable these initiatives to happen. So that's what we're trying to do with this conference, by the way, bringing in here all the stakeholders, the decision makers, and National Science Foundation is going to be here. The World Meteorological Organization is going to be here. NOAA is here. So bringing all these high-level decision makers together with the climate scientists, the program managers who review proposal, hopefully will help us at the end of this conference to come up with good recommendations that can entice funding agencies to fund joint research, multidisciplinary proposals that will lead to implementation of climate-based forecasts. We need to make sure that we entice climate scientists and health scientists to really have that vision, to have that in mind, that we need to work together if we're going to implement climate-based early warning systems. and that, science, as it's done in academia, is not going to be useful until it really benefits society. So to benefit society, the science need to be transitioned into operations. So that means that academia has to work with government, has to work with NGOs, private sector, to make that happen. So I hope that we'll be able to entice funding agencies, let it be NOAA, National Science Foundation, NIH, CDC, to really consider multidisciplinary proposals that could lead to advancing early warning systems. So that's what we're going to try to achieve in this conference. Thank you.
Thank you. That's beautifully said and mapped out, and it made me think and wonder about when you talk about bottom up. My mind goes to the next generation, to students, to early career geoscientists. So Africa being such a young continent, having this superpower in youth, and really this is for everybody, but maybe we could start with you, Dr. Touré, as far as at UCAT and what you're seeing at the university in Dakar. How do we take what Dr. Thiaw was saying and sort of get that bottom up going from the kind of the bottom, from the students, from the early career scientists who are just beginning, who have great ideas, want to collaborate, want to have their voices known, but need somebody to meet them to get that action.
Yes, if I understood the question well, it's really working with the preparation. I think this really starts with training, really working on research. We're working more and more on operational research, really working with populations, really knowing what are the problems that the population is facing, thinking of certain problems that they're facing. So I know that this collaboration, of course, in the meantime, we have to work together, and of course this working together, starting from the beginning, these people who are training in geophysics, geohealth, and other areas of health. For example, the people who are training in public health and all other specialties. So like I said, it's really the link. It's really the connection between all these areas, all these sectors, that really will bring us all together, and will connect us all together.
Yeah, connections, interdisciplinary work, collaboration, I think has come through so strongly with everything that's been said. We have a few minutes left, and I want to make sure that everybody had a chance to address something, and maybe I didn't exactly ask it the way you thought I would. So maybe we'll go back to Dr. Pasquale. If there's an area that you want to emphasize again, another point to be made, something that maybe hasn't come up in the conversation that you're excited about these next couple of days, or just the issue in general on geohealth, the floor is yours.
Yes, maybe I'll make a comment about geohealth, because of course we are talking about early warning systems and therefore forecasting prediction. But really, there is no way we can evaluate the effects of intervention in public health, the effects of control efforts, without the context of climate variability. We need to evaluate control continuously. How are we going to do that in a context that is varied, when you don't know whether your results are the results of your efforts or the results of a drought or a flood? Or you absolutely cannot evaluate control in places that are climate sensitive geographically without that context. So I think you need to, it's not just forecasting, it's bigger.
Mm-hmm. Thank you. And Dr. Ramusha, same question, something that maybe we haven't necessarily bubbled up so much in this conversation here that you want to make sure it comes out.
Yeah, I would add first from what Pascal said, then I will talk about another thing. Because it's what we see in some of these projects and research is sometimes people try to minimize and very limit the relationship between climate and health. Those interactions are very complex. And to understand them, as she was talking about, even to measure if an intervention for a disease is working, we need to understand all those complexities. And that's why technology is important. Now we have machine learning, artificial intelligence. And I think these are the areas in the future that we need to embrace to be able that we understand those relationships better. So don't simplify it, because otherwise you might be just deceiving yourself that I'm seeing something happening, but it's not happening. Another point that I would like to raise, we are here with the meeting, we have mentioned a lot of stakeholders. There is a group that is not actually represented here unless we turn ourselves to that group. That's a community. Mm-hmm. And these are the people that they face the consequences. Mm-hmm. And in the room, I always try to push the researchers, even for example, the young ones and the advanced ones, sometimes turn yourself to be a community member and think from the grassroots, like, what would I be? What would I contribute to this? Forget science. Mm-hmm. Think of the lines of the things in the life that you do, and then try to incorporate that, share that to people who they are doing experts work. And I think as we are pushing forward, that stakeholder, which is a community, has to be always put in the center of our discussion and our decisions.
Mm-hmm. I'm so glad you mentioned that community science is such a key part of this and everything else that's going on in geosciences and earth and space science, and a big part of AGU's efforts with so many partners around the world. So thank you. Dr. Touré, and then we'll finish up with Dr. Chat. Anything you want to add before we finish?
No, it's okay.
Yeah, good. You're ready to start the conference.
No, not stop, but
no, to start. Yeah.
Yes. I would like to just piggyback on what she was saying. The implication of communities in scientific research, because that is extremely important, and for us to be able to advance, to be able to make a change, we really need to work with everyone.
Merci. Dr. Chow.
And I think that is the social science aspect also that we have been talking about. This is an integral part of early warning systems. And I think that for a long time, social scientists have been working, doing a lot of assessments, surveys, and climate scientists have been working, doing their forecasts, and you have health scientists also trying to make these connections, but we were not really talking, communicating. And I think that we now have gotten it, and we're working in the direction of really bringing all these communities together to make it happen, and making also sure that information that we provide get to the local government, local authorities, community organizations, who in turn can reach out to all the people that can suffer from impact of extreme weather climate events.
Thank you. Oh, excellent. Well, this has been a fascinating, important discussion, and so many words have been repeated in terms of modeling, in terms of collaboration, data, funders. But the word that I'm definitely taking away is also hope, and having such great minds and such great drive and focus and commitment to this, represented by Drs. Chow, Pasquale, Touré, and Ramusha. We're so delighted that you're not just kicking us off this morning, but that you're going to be with us for the next several days here in Washington, as all our other attendees. So thank you again. And we want to thank everybody for joining us, and please go to agu.org for any information to follow up on the conference, ways to get involved, questions. Thank you so much to our wonderful interpreter, Yannick, who has been with us throughout this morning. Have a good day and thank you again.
Thank
Thank
you.
you.
Thank you.
Bye.
Bye-bye.